And so what we really need to add to this data, once we segment the population, is what are those particular legal issues that are affecting utilization? And we've seen all of these, and this closely mirrors the eye health mnemonic, I think. These are all issues that we've had to deal with through our project with certain patients. But how do we capture this data? That's kind of what we need to do and overlay it on the utilization. The first part, and I think something that the federal government has helped us with, I'm not usually saying they're providing us gifts, but in this case I think this is a gift. ICD-9, switching over to ICD-10. ICD-9 for the lawyers in the audience stands for the International Classification of Diseases, not implantable cardiac defibrillator, although both can cause chest pain to the practitioner. And the reason is we have to code every visit with a visit code that makes sense so that we get paid correctly, number one, and number two, so that some research can be done on it. Well, what's nice about ICD-10 is they're expanding the number of social factors affecting health dramatically. So there's going to be much more specificity and granularity around issues like employment, physical environment, housing, food, adverse childhood events, social support, and other legal issues. So instead of just saying patient has a housing problem, we can define what kind of housing problem that is. How wonderful that would be. Now, why can't we overlay that then on the utilization data? And then you start to paint a picture for what these types of issues are that drive utilization. You also can discover, hopefully, how these issues can be impacted on by your transdisciplinary team. So if we're doing a good job without a lawyer, what are the issues that we're able to impact on? But when we get a lawyer, does it make any difference in terms of utilization? My feeling is that you need to involve the lawyer up front in the patient review. We sit down every morning for 1 hour and talk about 3 or 4 patients among the whole team. It's a lot of resources thrown into just discussing somebody. But I believe the lawyer needs to be in that discussion because they identify issues that we never would have identified or never even would have thought about. And I think that's going to be their value in a high utilizing setting. Social determinants need to be part of the diagnostic workup that many people have saying. And I think we need to capture this coordination between social work and legal. In part, we've done such a good job because our lawyer trained our social worker so well up front that it almost like she doesn't need to be around anymore. There has to be some benefit there on the legal side for us to show that this was really a value add to the whole process.